We're here today to hold our second hearing in just 5 weeks on the Ebola crisis in West Africa, to underscore just how serious a crisis they are facing, and I would say we are facing, an international pandemic which threatens to balloon unless confronted head-on. I spoke yesterday to Dr. Tom Frieden, Director of the U.S. Centers for Disease Control and Prevention, and the lead witness at our August 7th emergency recess hearing on Ebola, and he said that this is the worst health crisis he's ever seen. He said, "I've never seen anything like this in my life." And coming from the head of the CDC, that was an extraordinarily powerful statement. Since our August emergency hearing, we have seen a constant movement upwards in the number of actual cases, as well as the predictions of how many people may contract the disease and what potentially the number of fatalities might indeed be. The numbers range. Yesterday, the president was talking about hundreds of thousands. I read a German doctor who said something on the order of 5 million. That hopefully is way overinflated. But it underscores that nobody really knows, and we are talking about a pandemic that, even if it stays contained in the West African countries, is doing unbelievable damage and imposing unbelievable sorrow. The World Health Organization has estimated that as many as 20,000 cases of Ebola before it is ended. And again, the numbers have now begun to exceed that in terms of estimation. We are holding this hearing to take stock of where our intervention efforts stand, particularly in light of the President's decision to commit U.S. military personnel to Liberia to fight this disease. Liberian President Ellen Johnson Sirleaf, with whom I spoke yesterday, has conceded that the Ebola epidemic has overwhelmed her country, her ability to treat. She said, "This virus is spreading at an exponential rate." This was in a letter that she sent to the President. "This virus is spreading at an exponential rate, and we have limited time window to arrest it." She pointed out that well over 40% of the total cases occurred in the last 18 days alone. She said the treatment centers are overwhelmed, and she said, "At this rate, we will never break the transmission chain, and the virus will overwhelm us." An ominous statement from a distinguished president of Liberia. We're also holding this follow-up hearing this morning to determine if there's a reasonable hope for vaccines, treatments, and detection strategies in time to help with this health emergency. I hesitate to provide figures for the number of people who have died, but I think the estimates are something on the order of 2,500 people who have passed away, and that's probably an underestimation of the actual number. Ebola, which is mostly unknown in West Africa until now, presents itself early in the infection usually like a non-fatal disease such as Lassa fever, malaria, or even the flu. The temperature seen in early stages might even be brought down with regular medicines. Therefore, many people may not believe or may not want to believe that they have contracted this often fatal disease. If someone is in denial or unknowledgeable about this disease, they may not seek treatment until it's too late, both for them and for the people they unknowingly infect. Families in Africa tend to help each other in times of need, an admirable trait that unfortunately increases the risk of infection. The sicker a person gets with Ebola, the more contagious they are, and never more so than when they die. So burials that don't involve strict precautions to avoid direct contact with highly contagious remains of victims make transmission of this deadly disease almost inevitable. Burial traditions make avoidance of infection problematic. The porous, lightly monitored borders in West Africa lend themselves to cross-border transmission as people go back and forth along well-traveled roads and into marketplaces where hundreds of people also traveling make contact with those who are infected. Patrick Sawyer, a Liberian American, reportedly was caring for his dying sister a few weeks ago. After she died, apparently of Ebola, he left Liberia on his way to his daughter's birthday party in Minnesota. He collapsed at the Lagos airport in Nigeria and died within days. Had he left Liberia a week or even days earlier, he might have made it home to Minnesota, but he likely would have infected people along the way, including his own family. We can say that because Sawyer infected several people in Nigeria, which led to Ebola being transmitted to healthcare workers and then to dozens of other people. We will never know now if Mr. Sawyer realized that he had contracted Ebola and just wanted to go home for treatment, or whether he thought his symptoms were from some other illness. Many people are just like him, however, and they are spreading this disease even to places where they have been brought under control. For example, the Macena region of Guinea on the Liberian border was one of the first places where this disease surfaced. But by early September, no new cases had been seen for weeks. Doctors Without Borders closed one of its Ebola treatment centers to focus on harder-hit areas. Infected people leaving Liberia for better treatment in Guinea have once again made Macena a hotspot for the disease. The U.S. Centers for Disease Control and Prevention has established, as we know, teams in Guinea, Liberia, Sierra Leone, and Nigeria to help local staff do fever detection and to administer questionnaires on potential troublesome contacts. The agency also is helping to establish sites at airports for further testing and/or for treatment. Liberia and Sierra Leone are the hardest hit so far by this Ebola outbreak. This is undoubtedly partly because of the weak infrastructures of the two countries emerging from long conflicts. However, post-conflict countries also have significant segments of the population who don't trust the central government. The unfortunate mishandling by the Liberian government of an attempted quarantine in the capital demonstrates why trust has been so difficult to come by. The Liberian government, as we know, established barriers to block off the West Point slum area where, after a holding center for Ebola victims was ransacked and contaminated materials were taken. This quarantine was done without fully informing its 80,000 inhabitants or consulting with the healthcare workers. Not only did this prevent people from pursuing their livelihoods or bringing in much-needed supplies, this move created great suspicions over the motives of the Liberian government. This suspicion was heightened when the official in charge of the area was called to a meeting and was seen leaving just as everyone else was trapped behind barriers. The furor over the quarantine forced the government to abandon it 10 days into its planned 21-day term. Liberian officials assured us that they have learned from their mistakes, that the quarantine and has alerted Liberians of the reality of the Ebola epidemics. And I read many of the newspapers from West Africa every single day, and it is front-page headlines, sometimes a little bit exaggerated, but certainly front-page headlines, so people are becoming more aware through that medium. Despite the drug, the fact that the drug ZMapp appears to have saved some lives, including Americans Nancy Wrightball and Dr. Kent Brantley, I should say, who we will hear from in our second panel, there are no proven readily available treatments for Ebola. The death rate for this disease, once more than 90%, is now down to 53%, despite the number of cases growing exponentially. In Africa, few patients apparently have been successfully treated with ZMapp, and Dr. Fauci, I'm sure, will give us additional insights on this. And some others may have been saved using other treatment methods, especially when the disease was identified early. Yet there is not now, nor will there be in the short term, large quantities of this medicine or any others. There are several Ebola therapeutics under development, but if this outbreak cannot be brought under control soon, even the most optimistic timetable for the testing and production of these drugs will not be sufficient to meet the ever-expanding need. ZMapp was used with the informed consent of those to whom it was given, but how can we guarantee that the many Ebola victims whose most likely salvation would be to use an experimental drug truly understand risks of using a drug that has not been fully tested? Lack of faith in national and international systems fighting Ebola has impeded the replacement of many Africa healthcare workers who have died from this disease. That's one of the untold problems. The people on the front line are dying, as well as their families. I was talking to a friend who runs an NGO in Sierra Leone who works with obstetric fistula, and a nurse at his clinic, she died, and so did her 6 children. So healthcare workers have borne a disproportionate share of this horrific disease. As of late August, 164 Liberian healthcare workers had contracted Ebola and 78 had died, and that number, no doubt, has increased. Africa healthcare workers face an epidemic that threatens to defy control. The lack of diagnostic techniques and insufficient supplies of safety equipment have put these healthcare workers at extreme risk. These healthcare workers know that the lack of treatment centers and medicines means that those on the front lines of this epidemic are most at risk, as I indicated earlier. And finally, and without objection, we'll put my full statement into the record. I'll just point out that yesterday's announcement that some 3,000 American service personnel will be deployed. Obviously, that sounds, Nancy will remember, I traveled right after the typhoon hit in the Philippines, and if it wasn't for the military in providing food, water, shelter, and medicines, working with USAID and NGOs like Catholic Relief Services, many more Filipinos would have died as a result, and dengue fever and other terrible diseases might have manifested in large numbers. Same goes for the tsunami. I'll never forget, a number of us went and we saw what was being done in Banda Aceh. Again, USAID working with CDC, NIH, and the military. But this is a little bit different, and perhaps our witnesses could elaborate on this either during the Q&A or in their statements. What precautions might be provided to those service members? I know they'll be likely building beds, which are unbelievably lacking, particularly in Liberia. People can't find a bed when they're sick to get treatment, or at least to live till they pass. And so it does raise the question of what kind of precautions those military personnel, whether they will be properly suited, what will be their mission, and when will they be deployed. A number of questions have arisen, I'm sure, by many of us concerning that, to ensure their safety.